Morning. So a couple of thoughts for you this morning about dealing with patients and about how we interact with individual patients based on any number of factors. So I had a couple of experiences over the last couple of weeks that have given me an opportunity to think kind of introspectively about how we interact with patients and how it affects how we treatment plan and how we discuss things with them. You know, one of the most important things to me is making sure that all of our patients have the same opportunity to accept the best dental care in every situation. Now, basically what that means is we have to present treatment, the same to each patient. Now, we definitely want to cater to their individual needs and their individual situation and treatment plan according to what they need. But from a big perspective thing, if we step back and look at the whole picture, we want to make sure that our patients have the same opportunities that all the other patients do to move forward with the most ideal treatment. So take for instance, if we look at a patient who comes in, there are any number of differences that each patient will have. Of course, size and shape and skin tone and ethnicity and cultural background differences, et cetera. And you can choose to make whatever generalizations you want about whatever patients you have and whatever experiences and situations you've had in the past. But I would encourage you to consider eliminating all of those filters. All of us see through our own individual paradigm, our own little window based on our previous experiences in life. And I've found that if I can take and do my very best to take that paradigm and make sure that it's not getting in the way of my interactions with my patients, I think in the end it yields a much better outcome, not only for the patients from the standpoint of being able to have the opportunity to accept ideal care, but also for me because I feel better about interacting with everyone on the same level. The assistants and I just a little bit ago were talking about how different doctors, whether it's a dentist or a physician or a nurse practitioner or a surgeon or a periodontist or endodontist, whatever, a lot of us have, some of us, maybe not a lot of us, some of us feel like we're better than others based on our level of education or training or experience or age or income or whatever. And so some of this, based on what the assistants and I were talking about, is reflected in how we interact with our team and our patients. I find it's really critical to me personally that I remove those levels of chances for learning and income, et cetera, and make sure that we're all on the same playing field, if you will. Certainly I've got some advanced and specialized training going through 4 years of undergrad and 4 years of dental school, and the intervening decade or more, 13 years post-dental school of treatment that I've been able to provide for my patients and ongoing continuing education. Yes, I acknowledge there are some differences in my understanding and experience, but that doesn't mean I'm any better than anyone else. Now, might I have an elevated understanding of certain things, whether it's dentistry or otherwise? Sure, and that's all based on experience, but that doesn't mean that I'm better than anyone else. So I think if we bring ourselves to essentially the same level, certainly we have different responsibilities and requirements based on our particular job within the dental practice, but I don't think we should elevate ourselves above one another. It is critical when a team member starts in the office that they're given a very clear set of responsibilities and guidelines. Otherwise, we'll end up having difficulty allowing people to accomplish what's required of them. If I don't know what's required of me, how can I possibly accomplish it and feel good about my job? So it's important that we have our own individual sets of requirements and expectations, and that follow-up is done so that each of us can have that opportunity to learn and grow and become better. However, we want to make sure that we don't create a sense of hierarchy based on I'm better than you because I'm such and such. I'm the lead dental assistant and you're just a regular dental assistant, or I'm the owner doctor and you're just an associate doctor. Now, within our responsibility, there are opportunities and requirements for coaching, for oversight. So that's critical that we manage that. But that doesn't mean that I am better than anyone else. We need to see ourselves as equals in every sense of the word. but we need to fulfill our responsibility to manage and direct and lead and guide in our leadership positions respectively. So back to the conversation about patients. If I do a good job of presenting to any given patient, here's the problem that we see. Like, for instance, I had an older gentleman come in today who I can assume was on retirement, whether it's Social Security or some sort of a pension or a retirement plan. Excuse me. I could assume that he's not wealthy based on the fact that he came in with a gray sweatshirt. He had a Vietnam vet hat on. So normally you can kind of assume, not that I will, but you can assume that these individuals may not necessarily have a lot of money for treatment. Does that matter in how I'm going to propose treatment to them? Personally, I don't feel like it should. If we start pulling our punches and changing how we're going to recommend treatment to people, I think we're doing them a disservice and we're doing us a disservice. When I went through a training course several years ago, it's been a decade ago, one of the things that we were cautioned against doing was what's called a wallet biopsy. So every time we try to evaluate what someone can afford without knowing any of their financial history or any of their desires, we're essentially shooting ourselves in the foot. So when a patient comes in the door, we need to take the financial piece out of our consideration as a practitioner. Because if I start recommending treatment based on what I think they can afford, there's some potential that I may not be recommending treatment that's apposite to their situation, that's apt or appropriate. So we want to make sure that we're treating everybody the same, regardless of what we think their income may or may not be. So this gentleman came in, had a tooth that needs to come out, big abscess around the tooth, and we talked about a couple of choices. Choice number one is, let's look at doing a bridge. You already have a bridge. Let's look at another bridge in that situation, one more tooth. Cost-wise, including the root canal and the extraction and the new bridge, you're going to be in the realm of $5,000 or $6,000. On the other hand, here's the partial option. You could do a partial, take the tooth out, put in a partial that replaces a couple of missing teeth for a fourth of that cost. So I presented both options, and I told him, here's what I'd suggest is the best choice. Here's the second best choice, which may be a little less expensive, but here's the best choice and here's why. I answer all their questions. Certainly the conversation is a little more involved than that, but then I leave. Then the benefits coordinator comes in, has the financial discussion with them, and it's nice that they can have the discussion with me out of the room, so they don't have to worry about making me feel bad if they choose something that I may not have said is the best choice. And the financial coordinator, assuming they have a good trusting relationship with the patient, can come up with a good, what's the word I'm trying to say? A good appropriate treatment plan together with them based on their financial resources to move forward with treatment. So ultimately, they chose to move forward with the better treatment. Implants were not really an option for this gentleman, so the bridge or the partial were the only two choices short of doing nothing. And they opted for the better treatment, which obviously was more expensive in this situation. Now, had I only treatment planned a partial, only recommended an extraction and a partial denture based on their appearance, I would have been doing them a disservice and potentially hampering the opportunity for me to serve a patient. So that's all really I've got for you today, is we need to be cautious of how we view other people, whether it's based on their race or ethnicity, based on their life experience, their clothing when they come in, how they speak. A lot of us have kind of unique I can only think of it in Chinese Korean. The way we speak, how we discuss things, our language, sometimes will affect how other people judge us. So if we're judging people based on their accent, that's what I'm looking for, their accent, then the chance is we're going to be misjudging them. So all these outside factors that we see when we look at someone, whether it's their skin color, their height, or their weight, or their build, or the clothes they wear, it's really critical that we strip all that away and just look at people as people. Give them the opportunity to accept the best treatment in any given situation that we can. Otherwise, we're really not serving them well, and we're not serving the office, the practice, and it's a disservice to ourselves. So hopefully this has been informative. Generally speaking, most of us, I think, do a really, really good job. But it's important that we evaluate our paradigm and that window we're looking through from time to time to make sure that we're not allowing our observation or views of other people get in the way of what we should be doing, because it can be very easy to make a snap judgment based on an appearance that can be totally inaccurate. Now, in other situations, it can be critical to make a judgment based on individuals, etc., in any given situation. But for us in the dental practice, we want to pull all that stuff away, have a good heart-to-heart conversation with them, eliminate all that snap judgment stuff, and make sure that they're aware of good, better, best, and how we can help them in the long run. All right, thanks.